Myasthenia gravis. Imagine trying to walk, but the muscles feel weak and tired even though the client hasn't been doing much. Myasthenia gravis, a neuromuscular disorder where the muscles, which help in movement, become weaker and tire out faster than usual. What is myasthenia gravis? Myasthenia gravis occurs because of a problem at the neuromuscular junction, the point where nerves connect to muscles. Normally, when a nerve sends a signal, a chemical called acetylcholine is released, which helps muscles contract and move. But in myasthenia gravis, the body's immune system produces antibodies that attack acetylcholine receptors at the neuromuscular junction, preventing acetylcholine from doing its job properly. As a result, muscles don't get the signals they need, causing weakness and fatigue. The client might feel it in the eyelids, the arms, or even when breathing. Symptoms of myasthenia gravis. The symptoms of myasthenia gravis can vary, but here are the most common ones. The client may notice their eyelids drooping, also known as ptosis, or have double vision, diplopia. These are some of the earliest signs of muscle weakness. Many clients with myasthenia gravis experience difficulty chewing and swallowing, a condition known as dysphagia. A weak or hoarse voice is also common. In severe cases, breathing can become difficult, as the muscles used for respiration may be affected. Clients with myasthenia gravis may also have difficulty making facial expressions like smiling or frowning. Muscle weakness can affect both the arms and legs, making it difficult to lift objects or stand up for long periods. Fatigue is common, and muscles often weaken with repetitive use, making tasks like climbing stairs or walking long distances exhausting. Myasthenic crisis versus cholinergic crisis. In some cases, myasthenia gravis can lead to crises, emergency situations where the condition becomes life-threatening. Let's look at two types of crises: myasthenic crisis and cholinergic crisis. Myasthenic crisis. A myasthenic crisis happens when the body isn't getting enough acetylcholine. This can be triggered by things like stress, infection, or not taking enough medication. It leads to severe muscle weakness, especially in the muscles that control breathing. Respiratory failure can occur. To treat this crisis, more anticholinesterase medication is given to help boost acetylcholine levels. Cholinergic crisis. On the other hand, a cholinergic crisis happens when there's too much acetylcholine. This can occur if the client takes too much of their medication. This leads to symptoms like abdominal cramps, diarrhea, blurry vision, and excessive sweating. To treat a cholinergic crisis, the medication is stopped and atropine sulfate is given to reverse the effects of too much acetylcholine. Edrophonium or tensilon test. The tensilon test is performed by a neurologist to diagnose myasthenia gravis and differentiate between a myasthenic crisis and a cholinergic crisis. The tensilon test involves giving edrophonium, a drug that temporarily boosts acetylcholine activity. If the client's muscle strength improves after receiving the drug, it suggests myasthenia gravis. To differentiate between the types of crisis, in a myasthenic crisis, muscle strength improves after edrophonium administration, indicating the need for increased cholinesterase inhibitor dosage. In a cholinergic crisis, muscle weakness worsens after edrophonium administration, indicating overmedication. Let me ask a quick question before we continue. What would you expect to happen to the client's muscles if they have myasthenia gravis after receiving edrophonium? Atropine sulfate use in tensilon test. While edrophonium helps determine if the client has myasthenia gravis or is in crisis, it can also cause side effects, like bradycardia, ventricular fibrillation, and cardiac arrest. To counteract this, atropine sulfate is always kept on hand during the test. Atropine sulfate is an anticholinergic that works by blocking the effects of acetylcholine on the heart, preventing bradycardia and other adverse cardiac events to keep the client safe during the test. Treatment and management of myasthenia gravis. Managing myasthenia gravis requires a combination of treatments. The main approach is using medications like anticholinesterase drugs to boost acetylcholine levels. However, certain medications like fluoroquinolones and beta blockers can make myasthenia gravis worse and should be avoided. Clients should also wear a Medic Alert bracelet. Avoid stress and infections and ensure they're getting enough rest to prevent fatigue. Key takeaways. To wrap it up, myasthenia gravis is an autoimmune condition that affects acetylcholine receptors, causing muscle weakness. Thanks for watching and stay informed. If you found this helpful, like, share, and subscribe. For more medical academic insights, register on www.medocio.com, the #1 medical e-learning and social platform.